Hello, everyone, and welcome to Live United. I'm Terry Westerfield. And joining me today, I have friends who are in from New Orleans. It's the No AIDS Task Force. I want to welcome to the program Jean Redmond, who is the Director of Prevention at No AIDS Task Force. Welcome, Jean.
Thank you. Good to be here.
I'm glad you're back. And also, we brought with you today Allison Verdevac. And Allison is the Community Projects Manager at No AIDS Task Force. Welcome, Allison.
Thanks. Happy to be
I'll tell
here.
you what, you both play a very important role. And for those of you who may not know the history of No AIDS Task Force, let me just tell you a little bit that it is a partnership for life, and it is one of United Way of Southeast Louisiana's community impact partners. The mission of No AIDS Task Force is to reduce the spread of HIV infection, provide services, advocate empowerment, safeguard the rights and dignity of HIV-affected residents and individuals, and provide for an enlightened public. And we're talking about HIV, but there are a lot of other things we're talking about that prevention, it falls under that. And Jean, right. This is where you come in. We're having a little bit of a conversation beforehand today. I also think it's interesting. People think HIV, oh my gosh, you've got two women on the show. It is not a disease that is just a gay man's disease, as many still are thinking way back in the dark ages when it was first heard about.
Right. Well, let me talk to you a little bit about the ongoing history of No AIDS Task Force.
Please.
We've actually gone through a huge transformation, and sometimes you will now hear us referred to as Crescent Care. And No AIDS has actually become a division of Crescent Care because we've become what's called a federally qualified healthcare center. And that means that we provide more than HIV services. We've expanded our mission. We've expanded what we do. We now have a clinic that serves the general community. It is a clinic that, if you don't have insurance or you need to find a primary medical care doctor, we can now provide that service. So we've really expanded for what we do, and we've referred to ourselves now as Crescent Care, and No AIDS has become a division of Crescent Care because our original mission, serving people living with HIV and AIDS, is still very important. It's still a huge part of what we do. We still continue all the things we did as No AIDS, but we've really added a whole extra spectrum so that, for example, if someone is seeing us because they're living with HIV and AIDS and their partner or their family is not, their family can now get medical care through us.
It is more of a holistic approach.
It's a holistic approach. We really felt like, we need to move forward. We need to have greater array of services. As we all know, New Orleans has, we struggled with a lot of things post-Katrina. And we've come back in a whole lot of areas, which is really exciting to see. But one of the areas is medical care. And so when we felt that gap, we said, let's move forward with this. We actually do have a clinic, Crescent Care Health and Wellness Center. We have, and so people, if they need a medical home, we are able to provide it now.
Well, let's stop right there and give that address, give some information, because people who are listening today may say, I think I need the services. Where do I go? What do I do?
Oh boy. So no.
Should they call a number first or go online?
They should call a number first.
Okay.
And I am totally blanking.
207-CARE. 307-CARE.
307-CARE.
Go to crescentcarehealth.org.
And
or you can also
call
the No AIDS number, which is 504-821-2601. And they can certainly give you the number.
Okay, and I tell you what, let's do it all again. Because, Jean, I blank all the time. I think it's normal. Anybody who's listening today, do you know what your own home phone number is right now?
I do, yeah.
No, but
it's 2 digits off from a restaurant that has 24 hours in the French Quarter. Anyway.
No, but this is very important.
It is important.
And Allison, again, you said it is 307-CARE?
I believe so. 504.
But the best thing to do, and so many most everybody, knock on wood, and we hope that all will sometime soon, is go to the internet, and that would be
crescentcarehealth.org.
And that makes it a lot easier. Now, I'm taking what you said, Jean, because I think you went on here, and boy, it's been almost a year last time you were here.
Sure
we did talk about this.
We got older, didn't we?
And some of the mission
no, we didn't.
has changed, but that's because you have adapted. You were mentioning Katrina. We're coming up on the 10th anniversary of that.
Yes, we are.
We've all changed. We've adapted to, and especially, I think, social service, nonprofit agencies to adapt to the needs of the community. And I think, again, here's what No AIDS Task Force did that was so good. They saw the changes. They saw what was needed. And here you've developed this holistic approach that I think you always had a little bit there because you've been incredibly well organized and really kind of leading in healthcare for our folks who have been with HIV.
We've really tried. We tried, it's about how do we serve the community? How do we do the best job we can for our clients? And a lot of that really means that we need to be able to adapt and change and question what we do. You never improve unless you're willing to give yourself a hard look and say, okay, what can we do better? What are we not doing as well as we could? How do we change that? What do we need to do? And that uncomfortable process of change, to constantly go through it. There's no, oh, this is why we've always done it. That's, well, you did that last year and that doesn't count this year. And so it's keeping that really attitude of fresh of how do we continue to expand. We've looked at a lot of things. I mean, one of the reasons where Allison is because we felt we need to be out in the community. To do particularly prevention, particularly HIV prevention, we need to be out in the community. A clinic is great. It's great to have those services that you can get, but people don't always think about things until, they're at a place they're comfortable, like a bar in the French Quarter. And then a prevention worker comes up and talks to them and reminds them. And we do things like HIV testing. And so suddenly it's bringing things to the community in a way that the community engages in how they feel comfortable.
Well, you're getting the message to where it needs to go.
Exactly.
Well, let's talk about that. Then, if you don't mind, Allison, and picking up the narrative a little bit here, because what are some of these programs? Jean, I think you've mentioned before, but I think that was an interesting way of outreach, going to different places like that and connecting with people where they are, where they're the ones who might need services. So, Allison, let's talk about some of those.
Sure. So I am housed in the CAN office, which is at 507 Frenchman Street, right outside the French Quarter. And we do a lot of services within that office, but that is sort of our hub for the community outreach and services we provide to targeted populations throughout New Orleans. So one of the things Jean just mentioned is HIV testing in some of the bars in the French Quarter and surrounding neighborhoods. We pack up all our equipment for HIV testing, and all this testing is rapid and done with a finger stick right on spot. So it's very quick. Folks are getting their results almost immediately after talking with a counselor.
It's not like waiting in the old days where it used to be. Yeah.
No.
People were afraid to go because they couldn't stand the wait.
Right. Yeah. So we provide results, rapid testing at all our testing locations. But we pack up bags, we pack up our equipment, and we go out to these sites, and a team will sort of canvass the venue and remind folks that HIV is still very present in New Orleans, that testing is pretty easy, and that we're doing it right here. A lot of times people might not think that in a bar is the right time or place for them, so we'll refer them back to our offices where we provide HIV testing. Between our three main prevention sites, we have HIV testing 6 days a week.
But again, you've gone to a place where now they've made the connection, and even if it's an embarrassment, they're a little bit nervous, they're downright afraid, let's just say that.
Yeah.
They know they can go to one of these areas in privacy and then be tested.
Yes, absolutely.
And that's the important thing, to be tested. And again, I guess I want to stress, because this is not just a gay problem, and that's what had been labeled for so long. In fact, I read some things recently that one of the populations that's on the rise, African American women.
Yes. Oh, yeah. That's been an ongoing trend. Yeah. Diseases do what they've always done, is that they go to the people that have greater barriers in life. They go to poverty. They go to people that, it's like, where do I live? How do I get food? I'm working 2 jobs. I need this relationship because I need the income that person's bringing or the resources they're bringing. So it affects across the board. Yes, you can look at statistically and say that what the public health jargon is, men who have sex with men are still one of the greatest numbers. But no one is immune. It's a virus. It is not a judge. It doesn't care. It will infect who it can infect. You talked about the HIV testing, and like you said, that's really important because you just can't know. Most people who have HIV will not have symptoms for a very long time. They'll feel fine. They'll feel healthy. They'll do everything. And, one of the things we do, and the community, there's no reason for the community to know that, but the testing technology has changed. In the old days, like you mentioned, it used to be you had to stick a needle in someone's arm, draw some blood, and send it off to a lab for 2 weeks. Now we do a finger stick, and we have a couple different tests, but we do a finger stick. One of those tests takes 1 minute to process after you initially start it. We're also doing a test that can look at what they call antigen production in addition to antibodies. So if someone gets infected with something, they produce antibodies after a certain amount of time for the immune system to react. Well, the antigens appear earlier. So the test, that's what they call a fourth generation test. It can look at antigens and antibodies. And so if you have someone who shows the antigens, that means that they're a very new infection. And one of the important things for that is oftentimes people who are newly infected before the immune system has had time to produce the antibodies, which will slow down the HIV infection, they often have a very high viral load. And when you don't know that you're infected and you have a high viral load, that's when you're most likely to infect somebody else. And so by moving this testing forward and working with the Office of Public Health, we can now do what we call a double rapid test. So in other words, someone needs to get into care. They need proof of diagnosis. They need proof that they actually are infected with HIV. So in the old days, it used to be, we did a test that was a screening test, and then again, they had to get the lab test, and then they had to, get the confirmatory test. Well, now with the double rapid, you'd use two different testing technologies from two different companies, and if you get the same result, that there is infection, then that is now diagnosis, that stands for proof. And so that way we can move the person on to this next step. Yes,
yeah.
Exactly. They get into care quicker. And that's an important
And that's
thing.
the whole point.
Yeah. Yes.
Now, because I know that care has changed, and especially when we're talking about the drug cocktails and things that used to be, as medicine catches up, shall we say, or it gets better in
Yes,
terms of
yes.
treatment options. There are a lot more. This is not a death sentence. It does
No,
not
absolutely
have
not.
to be a death sentence.
No, and that's the important thing about getting people tested is that it hits young people. So I'm an older woman of a certain age.
We won't talk about that, Jean. Likewise, yes.
So, if I get hit by a bus, then I'm going to lose 20, 30, maybe 40, not likely, but, years of life. But if someone who's 20 or 16 gets infected with HIV, they have 60, 70 years in front of them, maybe. And so we lose a lot more when we lose young people than we lose older people. And that's why fighting HIV is so important, because we don't want to lose another young generation.
Well, that's it. But when you're younger, too, you think you can do anything.
Right,
You don't think you're vulnerable.
Yeah. I mean, I think young people, there's sometimes an attitude that HIV, that was back then. We have a generation of young folks that didn't grow up, and myself kind of included, didn't grow up immersed in the epidemic,
That's okay.
didn't witness people suffering before medications were available. So I think there is sometimes, it couldn't happen to me, or that's not our problem sort of attitude.
If I get it, I just take a few pills and I'm fine.
And I'll be
It's much
okay.
more complicated than that.
Well, all right, but AIDS now, and I'm kind of making kind of evaluate. It's like polio or something else. You conquer it, but if you don't keep up with what you need to do to keep it under control, it can come back.
Yeah.
And in a sense, that's kind of what you're saying, Allison.
So-
If
A lot of medical providers will equate HIV to sort of diabetes care.
Okay.
So if you follow the regimen, if you're making regular doctor's visits, if you're exercising, eating healthy, not smoking, not drinking too much, your health outcomes should be pretty good. And by checking in with a doctor regularly, you navigate the course of infection to make sure that you're staying as healthy as possible. HIV is similar in that if you were to ignore those recommendations from medical providers and not eat well and drink too much or smoke, then HIV is going to take advantage of that and make your health outcomes not what they could be if you follow the guidance of medical providers.
and hence why we're having prevention here. Let's
Absolutely.
stop
Right.
it before
Well,
it starts.
Yes, and prevention is certainly the initial. We want to prevent people from getting HIV. We were talking a little bit in the lobby about syphilis. It's like, well, why is this 19th century disease coming back? And the Office of Public Health has just issued a public health alert for the New Orleans region because we've had an increase of, 2/3 in the last few years?
The number of cases diagnosed since 2012 to 2014 has tripled in New Orleans.
Wow. Okay, now we were also, as you mentioned, talking a little bit about this before the. It's sometimes people right now going, oh, I don't want to hear about this. But you remove your hands from your ears, folks. You do need to hear because we're talking about inhibitions. We're talking about New Orleans. We are a wonderful region. We have a rich culture, but we do have that kind of party mentality, and people from all over the world come here.
Yes, they do, and they come here because of who we are, because we have the bars that are open 24 hours, and those wonderful things. Often life has what I call double-edged swords. We do have this vibrant culture; it is wonderful, but there are things that when you get a little bit drunk, and as a friend of mine says, that dog in the corner starts to look like a poodle. Well, you oftentimes can make some decisions, and not being aware that you need to think about some things. Maybe
the consequences.
Maybe wear a condom, or ask your partner about their sexual health. Make sure you get tested. Syphilis can produce a sore that does not hurt. You don't feel it hurt. It goes away. So oftentimes people get it, they're not aware. It's like, oh, I had this sore. Sometimes they can be hidden in places you can't see. So you may not even be aware of it because, again, it doesn't hurt. Syphilis is curable. The problem is that if you don't cure syphilis, it can go on to have pretty serious consequences.
What, blindness and all kinds of things.
Yes, dementia.
And death.
Yes.
Yeah.
Yes, it can kill you. And for people who are living with HIV getting syphilis, it becomes a more serious disease, because one is attacking your immune system, and the other is putting burdens on your immune system. And people often think, STDs, you get them the same way as HIV, but that's about it. But the truth is that if you have an STD, you're more likely to get HIV. And the reason is, obviously, if there's a sore, like the syphilitic sore, that's a highway for HIV to get into your body. But what people don't think about is that when you get a disease, the immune system responds. And HIV latches on to the immune system, onto the T cells, the white blood cells. And so when you get the disease and it creates more of those down in that area where HIV comes in. So basically it's just having, it's like almost a little life preservers for HIV to grab hold of. And so when you have a disease that creates an immune response, even if you don't have a sore, then it's more likely that HIV is going to grab hold of one of those life preservers and then infect you.
And that's, again, when you made the kind of analysis, we were talking about diabetes. I would imagine this goes for anybody that has perhaps an autoimmune problem or something of some sort. Their body is already weaker, so that not only can you catch everything from the common cold more easily, but as you said, working your way all the way up to some very, very tough STDs and HIV. So you have to take precautions. And then again, this goes back maybe to some of the community outreach and the programs, Allison, that you're doing to make people aware of this.
Yeah, so we have forever done community outreach around HIV and HIV testing. We have a mobile medical unit that we bring to sites all across the city where HIV testing can be there, so that when folks respond and say, oh, your office is too far away or those hours don't work for me, we can offer an option right there and then. So we bring awareness of HIV consistently. That's part of our mission. That's been our mission, and that's what we do. And we're just incorporating syphilis into that very naturally. We offer some syphilis testing through the CAN office down on Frenchman Street, and I can give those hours
Please.
At some point or right now. So on
it.
Mondays from 5:30 till 7:30 p.m., and that's at 507 Frenchman Street. And then Thursdays from noon till 4 p.m., at 2610 Esplanade, which is at the corner of Broad and Esplanade, Suite 2B, which is above the dentist office.
Yeah, and that is actually walk-in syphilis testing.
Right.
And again, it's the kind of thing people say, oh, it couldn't happen to me. Oh, not me. But I think another reason why it's so great to have the mobile unit, you can take around. And I remember, honestly, the first time I saw it at one of our, I shall be nameless, but we have so many wonderful fairs and festivals and music
we
events,
do.
whatever. And I saw that. I was a little bit, I wouldn't say dumbfounded, but I said, well, what on earth are they? Duh. And that's why. Because, again, anyone of any age, race, creed, color, as they say, and go on, is and can become infected with an STD or HIV
Yes.
if they don't take precautions. And to have that right there, I was actually, I stood around, I have to tell you a little bit, and watched. And I would see people of all ages, and of course they'd look around, try to make sure there was no one like me watching.
Right, yes.
And then kind of jump inside. But I thought it was great that, hey, they were concerned, were worried, thought, oh my gosh, it's here, why not? And they were availing themselves of your services.
Exactly. And it's always completely voluntary. Whenever we're doing testing, we partner with Walgreens pharmacies throughout the city. We partner with community health centers, with community events, and it's always voluntary. And like I said, with bars, it might not be the best time or place for an individual to get tested, and that might be a decision they make on their own. But we always have information of where they can get tested through us or through other organizations at their earliest convenience.
Jean, you had said something earlier, too, about being a port city and people come in from all over. Is there, or do you try to kind of reach them when they're in town, too, to say, hey, you're here, you're letting down, going back to what we're talking about, your inhibitions, but you wouldn't do this at home, but you're here doing things. Otherwise, you're on vacation. You're going to throw caution to the wind.
This is, I guess, the New Orleans thing is, we actually have on Mardi Gras and Southern Decadence and times like that, we have a table that we put out at the corner of Bourbon and St. Anne. And we have a whole big stack of condoms and stuff that we give out, and we talk to people about, some of the rates of infection in because we want people to have a good time. And you don't have a good time if you go home with something you didn't want to catch.
Yeah.
Right. What happens in New Orleans doesn't always stay in New Orleans.
Stay in New Orleans, unfortunately. And it is when we do have this shifting population. That is something, or I say shifting, but it grows, morphs for all these major events. That is something to be aware of because we don't want this city to be the one that spreads misery to others.
Yeah. No, we don't. And there's been some research that says that people actually do come here and they will do things that they didn't necessarily do back home. They feel that there's some liberation. It's time to let down and have a good party time, which is great because we want that, because that's one of the beautiful things about New Orleans is we can just walk down the street and sip our Go Cup and sing along and all that sort of stuff. But again, there's we don't want people to catch anything. We want to prevent. I mean, that's what our department is about. Is really about prevention.
And again, you've got so many different things that you're doing, and it all feeds back into what you were talking about with Crescent Care. This is a holistic approach. So there are other things that you are offering as well.
Right.
Yes. We look at what they call again the continuum of care, and that is that people need to be aware. The first step is, okay, is this a problem? Is this an issue? Could it affect me? And for HIV and for actually any disease, it's okay, I need to be aware that I could possibly be at risk for. I need to get whatever diagnosis, testing, whatever. And then I need to move into care. And then once I'm in care, I need to stay in care. I need to be adherent to medications. And, living with HIV, as we noted, you can live a long life, but you do have to take medication. You do have to take medication that will suppress HIV and prevent it from doing the damage to the immune system. And that's possible, but it takes adherence to medication. Just like it takes adherence to medication to keep blood pressure down, it takes adherence to medication to fight diabetes. So all these things play in. So it's not just, we're going to provide this one shot of care. It's how do we provide a long-term relationship that we make sure that both in HIV and all the other health areas we're going to be dealing with, that we make sure that people live long, healthy lives. And it can be focusing on, as we mentioned, we have a nutritionist on staff. We looked at doing cooking classes because it really is important. You can do a whole lot to keep yourself healthy besides just going to the doctor. And we want to acknowledge that and recognize it's not just walking into a clinic that's important for your health, but it's all the things that you can do. And we want to be a partner for people in all the decisions they make that can help them live healthier lives.
All right, now you're talking about an HIV, but that what you're saying is also good for everybody.
Yes.
To eat healthier,
Yes.
be healthier, sleep.
Yes. Yes.
And it struck me again when you were talking earlier, what is the face of AIDS? Well, you can't choose one because you said AIDS doesn't make it's just anybody. And so
yes.
it doesn't matter the way you're dressed, what your gender is, your preferences, any of these things, you could be at risk. So again, being able to be prepared, to take precautions, to eat healthy, be healthy, and you can be a very unsuspecting partner.
Oftentimes, when we talk to clients, I think the general image is, people who are out having a lot of sex partners. And a lot of times it's not.
Or on
it's
the
people who's
street or something, yeah. And that's not necessarily the case, is it?
We hear so many times, I trusted him.
Yeah.
I didn't know, and intimacy and trust are hard things. They're the things that we as human beings desperately need, we desperately want, and we should have. But oftentimes, trying to get there, some people are really scared to reveal they have HIV, and so they make some, what in my moral judgment, what I call bad decisions. They don't tell their intimate partner that they have it. They wait until too long. They try and hide from something they don't want to acknowledge. And then that other person who thinks they're with someone that they care about and love finds out the hard way that there's a disease in this relationship. And oftentimes that is how it's yes, it can be because you're having a lot of sex partners, but it could also be because you tried to trust someone that maybe needed to tell you some more information.
And it could be somebody, it sometimes seems as though you're trying, how to explain it, that there is, here is what you think of as the typical marital relationship, and here are others. But in a typical marital relationship. If a partner has sex outside marriage and you don't know about it, you have been exposed.
Yes, you have.
And I think that's what some people, they can't get past that because it's just that would happen to someone else. That wouldn't happen to me.
You know, again, like I say, it's a virus. It's not a judge. I remember, doing a counseling and testing session where I had two clients. One was a young gay man who had a number of sexual partners, and another was an older woman who was widowed and had started dating again. She was the one who tested positive, and he did not. That's what I mean. Statistically, was he at higher risk? Yes. But again, it's a virus, and no one individual is a statistic. You can say 99% don't have it, 1% do, and there's no guarantee you're not that 1%. And that's an important thing to remember is, you will never, ever fall, into a statistical pattern because you're a person. You're not a number.
And I think that is very, very important. Allison, I see you looking. You've got a wealth of other information. Please share with us.
Sure. So I had mentioned before that the rates or the number of diagnoses of syphilis cases has increased. New Orleans has historically, and Louisiana for the last 10 years at least, ranked in the top 5, and sometimes at number 1, sometimes at 2 and 3, for HIV case rates, for AIDS case rates, for chlamydia, for gonorrhea, and for syphilis. So all of those infections that we can either test for or refer folks to places to test are very present in New Orleans at higher rates than most other cities and most other states. So just reiterating prevention and knowing your status. With chlamydia, gonorrhea, and syphilis, those are bacterial infections, so they have a cure. You take antibiotics and you clear your body of those infections.
And they will be gone.
Yes. You can get it again.
Right. You go back to that same partner, or years down the road you have a new partner. But you can clear yourself of those infections and thus improve your ability to prevent other diseases if you come across those. As Jean was saying, having an STD could make you more likely to contract HIV. If you're exposed. With HIV, again, we do rapid HIV testing 6 days a week at our offices, and then we're out in the field just about every day of the week, and provide linkage to care for anyone who does come back positive. So we're not just going to tell you, oh, your tests both came back positive, go find someone to take care of you. We're going to help guide you through that process. It's sometimes a little overwhelming when you try to think about, how do I access HIV care? I don't have insurance, or I do have insurance, but it's not very good. We have staff members who are tasked with that job. That is their role at the agency, is to help people walk through that process, either getting care through us, through our HIV specialty clinic, or through another site that might be better for the client, or that the client chooses to go elsewhere, or geographically it's a little difficult to get care here. Our linkage to care coordinator has even worked with someone outside of the state to help them get into care in Mississippi.
And that's what's so amazing, because you're trying to prevent any gaps. You're trying to make sure that
Absolutely.
no one falls through.
No point in testing people unless you get them into care.
Exactly. Because what's going to happen?
Yeah.
They know, and now that's it. No, you can't do that.
Yeah.
And you've been wonderful for this. I'll tell you what, people who are listening, again, they're running right now to grab that pen or paper. Let's give the numbers, let's give the address, let's give the email, whatever is best, so that they can get connected to a service they or someone they know might need.
Great. So if you were looking for any of our testing services, you could go to noaidstaskforce.org and click on the prevention tab and go to testing. It has not been completely updated with our venues, so do call our offices if you are hoping to go to a venue and meet us there for testing. For testing outside of NoAIDS, you can go to hivtest.org. So if you're not right in the New Orleans area, or if you're on the West Bank, you can go ahead and type in your zip code, and it'll tell you the nearest places to get free rapid HIV testing. So our website is a great resource for our services. And then if you ever have questions, you can go ahead and call 504-821-2601. That's the NoAIDS Task Force main office line.
And say that one more time.
504-821-2601.
Thank you so very much. And that was Allison. I'm going to say it right. Vertivec?
Vertivec.
Almost
That's
had
okay.
it there.
Yeah, what
all
the
right.
heck,
Oh,
Vertivec?
what a heck, Vertivec, the Community Projects Manager for No AIDS Task Force. Thank you, Allison. And thank you, Jean Redmond, who is the Director of Prevention at No AIDS Task Force.
Well, thank you, Terry, very much for having
We're
us.
glad you're here. I'm Terry Westerfield, and for United Way, everyone, let's live united.